Hello, I'm Dr. Pamela Ruig, and I hold the David J. Ellis Chair in Large Animal Clinical Sciences and Antimicrobial Resistance at Michigan State University. And as part of our continuing series on use of antibiotics in dairy cattle, today we're briefly going to discuss proper recording of antibiotic treatments. Now, if you've been following along or viewed any of our previous videos, you know that antibiotic usage in dairy cattle is highly regulated. And one of our requirements for antibiotic usage is proper recording of treatments. Now, these treatment records for antibiotic usage in dairy cattle are important not only to assure consumers that we're respecting the withholding periods and producing high quality products, but they're also important for us on the farms to document that we're using antibiotics appropriately and to record information that can help us appropriately manage animal health. Now, fortunately, because of the importance of this subject, there's lots of resources available to help us ensure that proper records are recorded. One of the most important resources we have is freely available on the Farmers Assuring Responsible Management, or the Farm Program website. And that's the Milk and Dairy Beef Drug Residue Prevention Manual. That manual's been around for at least 20 years, and it's updated routinely, and it has a whole bunch of resources that you can tap into for free to help find downloadable record forms and recommendations for what kind of information needs to be kept. So I'd really encourage you to check out that manual. Now, basically, it makes a lot of sense that all antibiotic treatments given to dairy cows must be recorded. And there's really two types of records we keep to comply with that regulation. One of those are the cowside records. These are typically temporary records. These are filled out by the person who's actually giving the treatment. So these would include treatment lists that are on clipboards with the person giving the treatments. They may be lists of cows that are treated in the milking parlor on a chalkboard or some other portable device like a cell phone. And these are what the worker uses to record the treatments as they're giving them. The data, however, in those temporary records needs to be transferred to a permanent individual cow record. And depending on your herd size and the way you manage your herd, those may be electronic cow cards in computerized herd management records, or they may be paper cow cards if you've got a small farm. So either of those can be sufficient to serve as a permanent record, but it's important that you have a system that allows you to keep those permanent records for 2 years, because the requirements are that the treatments for dairy cattle need to be maintained while the animal is not only in the herd, but for a full 2 years after the cow has left the herd. Now, because of the importance of this topic, we've got a lot of tools to help us do this. Many computerized herd management programs can create automated treatment logs, automated treatment protocols, and alerts for when withholding periods are met. So depending on your circumstances, I would really encourage you to work with your local veterinarian to set up the right system that works for your herd. Now, regardless of if we're using paper records or computerized records, the data that needs to be recorded in those records is the same. And it's pretty straightforward. What we need are the animal identification, the date of the treatment, the disease or the condition that's being treated, and then the name of the treatment, the dosage, the route, and the duration. With that information, we then can record the required withholding period for milk. In other words, the amount of time that the milk needs to be discarded to make sure it's residue free, and the number of days the cow has to stay in the herd before she's eligible to be sold for meat. It's also a good idea to record the name of the person who actually gave the treatment because that ensures some accountability. So for example, let's say we got cow 3498 and she is diagnosed with mild clinical mastitis on January 25th, 2023. For her treatment, we're going to use labeled treatment, and I'm not endorsing this treatment. It's just an example of labeled treatment with the Today product using the label indication. So that's 2 intramammary infusions 12 hours apart. For that product, following the label indication, we would have a 4-day milk and a 4-day meat withholding period. So both milk and meat would be eligible for human consumption after January 30th. Then of course we had Jimena who gave that treatment, and we put down either her name or her initials. All right, let's just finish up and recap. Obviously, all antibiotic treatments given to dairy cows need to be recorded, and we have to remember to keep those records available for 2 years after the cow leaves the herd. Many dairy herd management programs can help with this process, but regardless of if we're using paper or computerized record, the data that needs to be recorded is consistent. And you can find examples of this information by taking a look at that farm program manual. Now finally, let's just think about what we're actually trying to accomplish. Complying with recording, proper recording for antibiotic treatments is important to ensure consumers that we're committed to producing high quality, residue-free dairy products. But it's also important for us as we manage the cows. It helps us keep track of treatments and appropriately manage animal health.